Do you have any friends or family members suffering from dementia? Dementia is an umbrella term for several neurological conditions characterized by a progressive decline in cognitive function. Alzheimer's disease, or AD, is the most common form of dementia, responsible for up to 75% of all cases. AD significantly affects individuals, families, and the economy, with estimated global costs of $1 trillion annually. Last year, it was estimated that there were 50 million AD patients worldwide, and according to current projections, this number will double every 5 years, reaching 152 million by 2050. The research into the probable causes of AD is complex. AD is a multifactorial disease associated with several risk factors, including age, genetics, and lifestyle. The lack of curative treatments for AD emphasizes the importance of further epidemiological research regarding risk factors. To begin with symptoms, memory impairment is a major and early sign of AD. As AD has a gradual onset, memory loss may initially manifest as forgetfulness, difficulty performing familiar tasks, or remembering recent events. As the disease progresses, memory disturbances become more serious, and patients may experience a decline in other cognitive domains, such as executive function, language, social, and visuospatial skills. A loss of insight may lead to behavioural disturbances, for example, aggression, social disengagement, and agitation. To diagnose Alzheimer's disease, doctors often use brain imaging tests, such as MRI or PET scans, among other diagnostic tools. In AD patients, these scans will show a loss of brain volume. This process is called brain atrophy, and it is caused by a loss of neurons and the connections between them. As neurons die, the brain shrinks. During the early stages of AD, brain atrophy is observed in the medial temporal lobe, particularly in a brain structure called the hippocampus, which is responsible for learning and memory. By the final stages of Alzheimer's, brain atrophy is widespread and may be observed in other regions of the brain. But what is the cause of brain atrophy in Alzheimer's disease patients? To summarize, AD is characterized by two hallmark pathologies. The first is the accumulation of a protein fragment called beta amyloid peptide. This protein fragment is produced from a process called proteolysis, whereby enzymes break down a transmembrane protein called the amyloid precursor protein, or APP. In a healthy brain, beta amyloid peptides are broken down and eliminated. However, in an Alzheimer's brain, this protein fragment can accumulate outside neurons to form hard, insoluble plaques, particularly in the hippocampus, amygdala, and cerebral cortex. The accumulation of beta amyloid peptides induces the second hallmark pathology of AD, known as neurofibrillary tangles, or NFTs. Healthy neurons are supported by structures called microtubules, which help transport nutrients and other substances. A protein called tau plays an important role in stabilizing these structures. However, in Alzheimer's disease, the tau protein detaches from the microtubules and accumulates inside neurons, forming neurofibrillary tangles. Eventually, these tangles block the neuron's transport system, disrupting the communication pathways between neurons. The result is neuronal death throughout the brain, specifically the loss of cholinergic neurons, which are responsible for synthesizing a neurotransmitter called acetylcholine. As this neurotransmitter plays an important role in brain functions such as learning and memory, the loss of cholinergic neurons in AD explains the common signs and symptoms of the disease. Currently, there are two categories of drugs available for the treatment of AD: acetylcholinesterase inhibitors, for example a drug called donepezil, and NMDA receptor antagonists. Drugs such as donepezil function by inhibiting an enzyme called acetylcholinesterase, which usually breaks down acetylcholine. By inhibiting this enzyme's activity, These drugs increase synaptic levels of acetylcholine and assist with the symptoms of AD. However, this is precisely the problem with current treatments for AD. They do not prevent neuronal loss, brain atrophy, and, consequently, the progressive decline of cognitive function. As such, the focus is turned to therapeutic interventions that will target the underlying causes of AD. In the future, anti-amyloid and anti-tau therapies may be more effective at treating Alzheimer's disease. Recent studies have considered the use of vaccines, which would stimulate the immune system to produce antibodies against beta amyloid plaques or pathogenic forms of the tau protein. As AD becomes a growing worldwide concern and a significant burden on healthcare systems, it is imperative that there is a better public understanding of the disease and continued research into treatments that address its underlying causes.